the latest scientific research released by the World Health Organization has found that cases of anxiety and depression have increased by over 25% globally due to the COVID-19 pandemic. Loneliness, fear of infection, suffering, and even death for oneself and for loved ones, grief after bereavement, and financial worries have all been cited as stressors leading to anxiety and depression, while exhaustion has been a significant trigger for suicidal thinking amongst health workers. To help us unpack this further, I'm now joined via Zoom by Giulia Criscuolo. She's our favorite pharmacist, complementary medicines expert and life coach. Giulia, thank you so much for joining us. A very good morning to you. It's always a pleasure having you join us this morning.
Thank you, Simpiwe. Good morning.
Now, first of all, talk to us about this study conducted by the WHO and this steep global increase in anxiety and depression due to the COVID-19 pandemic.
Yes, Simpiwe, startling figures by this WHO study where we see such an increase in anxiety and depression globally. So it's not just South Africa, but globally. And interesting enough, the study also showed that it's taken a great toll on mental health and also mental health services during this pandemic. And the pandemic seems to have impacted young people and women to a greater degree. The studies show that there was a much greater increase in suicidal behavior and also self-harming behavior. So definitely quite bleak in terms of these statistics, but there's a lot that we can do, and hopefully we'll cover that as well.
I know that money or financial considerations are one of the triggers, but let's talk about some of the stressors that lead to this increase in anxiety and depression.
Yes, you mentioned them in the beginning. Some of those things would be like loneliness and isolation. So many people have felt so disconnected from other people, from friends, from family, from loved ones, and physically isolated, so there's no contact. And that really has a huge impact because as human beings, we need connection, emotional, physical, and mental. So that's been a huge impact on people. And also, as you said, losing loved ones, friends, that whole process of grief and bereavement is quite a journey, and it's been a lot for many people. Also, financial worries. So many people have been impacted financially by this pandemic. They've lost jobs, income has become reduced, things have changed, and that creates a lot of stress for many people. And also, as you said, just the fear, this constant bombardment, which leads people to be so afraid, so much uncertainty, so much worry about the future. What's going to happen? When are things going to go back to normal? Will my life be the same again? Can I carry on? There's a lot of uncertainty, and fear has a great negative impact on our physical and emotional and mental well-being. So we need to really be vigilant and recognize these things and say, okay, this is what's happening now, but how can I respond in a way that my body, mind, nervous system is able to feel safe, be calm, despite what's happening in the outside world.
And what kind of unhealthy coping habits that we've been, engaging in over this period, and how can one break these unhealthy habits?
And we are all human beings, so we all have different ways of coping with stress.
Yeah.
Some of them are more skillful and some of them are not always so helpful. But I don't want to create any judgment or shame because we all have different ways of coping. And some of these can be, for example, turning to food and eating as a way of comforting and self-soothing ourselves. But if that is in the extreme, then it's not helpful. Sometimes we smoke a lot, more than normal, or we use substances, certain drugs that really affect our well-being. For some people, it might be alcohol. Alcohol might be a way where they cope with life. But again, if it takes over your life and becomes unmanageable, it's not helpful. Some people go online. They take out their phone and scroll mindlessly for hours at end just to cope with this onslaught of what's happening in the world. Other people shop. Some people turn to pornography. We all have different ways of coping. And if these ways make us feel out of control, they have an impact on our well-being, on our relationships, then we need to really stop and take a step back and look at what's going on and recognize that this coping habit is actually not helping me, and maybe I need to do something about it.
You know, Giulia, in the past couple of weeks, I've discovered a very healthy comfort food as a coping mechanism. Whenever I'm feeling stressed, I'll just whip up a smoothie. I'll put in as many fruits as possible into the blender and come up with a smoothie. Well, for some reason, it does work on me. And having said that, how does good nutrition and a healthy lifestyle improve anxiety and depression? And what tips can you recommend?
Well, that's great, Simpiwe, that you found something healthy to work for you. You know, a healthy smoothie with lots of good things is a wonderful way of supporting the body with good food. So you know, kudos to you for doing that. So good nutrition, fruits and vegetables, nuts and seeds, good quality protein, lots of water. Those are good ways of taking care of the physical body. Also, we've spoken about it before, just going for a walk in nature. Instead of reaching for the cigarette or that next beer or the food, go for a walk. Just get out into nature, move your body. That is a wonderful way of increasing the good chemicals in your brain and helping you cope in a healthy way. Also, get support. Sometimes we think we've got to do it all on our own and we feel ashamed, perhaps, because we're not coping. But really, it's really courageous to reach out and ask for help. Maybe 2 or 3, 4 sessions with a counselor or a spiritual advisor that can just provide a space where you can share and you feel safe and understood. That can be really, really helpful. And important also is, as I said, get into nature, get outdoors, connect with good friends that you have a good rapport with. They can give you understanding and kindness without judgment. These are healthier coping ways and coping mechanisms. And just, I've often said this, deep breathing, just taking lots of good deep breaths in the moment just helps us come back to this moment and out of the thinking mind, which can often be a lot of chaos and confusion.
There we have it, a healthy lifestyle, good nutrition, and you just mentioned support as one of the many coping mechanisms. But can you also add supplements as one of the coping mechanisms? And which ones? If so, which ones? Because at the pharmacy the other day, I saw a mood-boosting supplement, and I was quite intrigued.
Absolutely. There are so many wonderful herbs and vitamins and minerals out there that can really support the body-mind system when we go through these challenging times. And I look to nature like ashwagandha. Ashwagandha is an ancient Ayurvedic herb that has been used for millennia. It's called an adaptogen because it helps the body adapt to stress. So if your system is operating too low, it brings it up. And if it's too up and hyper and stressed, then it brings it down, back to normal range. Ashwagandha also supports good sleep. It helps your cognition, your memory, helps your immune system. So Bioshodan ashwagandha is a wonderful supplement. Also, vitamin D is important. Omega-3, Felix or saffron extract has been shown to support people who are feeling a bit down, depressed. It helps to increase serotonin in the brain. Magnesium is really good for our nervous system. So these are some of the supplements that can really support the body-mind during these challenging times.
You know, Giulia, I know I've asked you this several times before in our previous interviews, but I suppose we can never overemphasize its importance of what lifestyle or dietary changes we could make to improve our mental health.
Yes, lifestyle goes a long, long way. And we've spoken about good nutrition. We've spoken about exercise and moving the body. We've spoken about support. These are all very important things. And the other thing is mindfulness. We often hear about mindfulness, and what does that actually mean? It's just about slowing down and coming present to this moment. So say, for example, you're sitting at your desk with all these bills and you're feeling so stressed about all these bills you have to pay. And you notice that you're getting more anxious, your shoulders are hunched up, you're feeling more and more stressed. It's just in that moment, just stop, pause, go and make yourself a cup of tea or go and sit outside and just breathe and become mindful. In this moment, I'm feeling stressed, I'm feeling anxious. So just slow down and help the body-mind calm down by a few deep breaths. And then in that moment, there's more space. And there's more space for creativity. Suddenly you find yourself having an idea. Okay, maybe I can do that. And that is very, very helpful. But if you're all contracted and stressed, there's no space for creativity, for resourcefulness, for possibilities. So calming oneself down by putting your 2 feet on the grass, breathing, is a really wonderful way of bringing more mindfulness into the situation rather than distracting yourself with unhelpful coping skills. And as I said, speak to a good friend, a counselor, spiritual advisor. It's really, really helpful. We need each other. We can't do this alone.
And we always need this piece of advice. Giulia, lovely chatting to you. Thank you so much for joining us.
Blessings. Thank you so much.
Great stuff. Thank you. Well, that was a pharmacist, complementary medicines expert and life coach, Giulia Criscuolo, and she's been speaking to us about a recent study on how anxiety and depression has increased by over 25% globally.